Hi everyone. My name is Dr. Ashir Khalid, an international medical graduate currently completing my internship at Pakistan Institute of Medical Sciences. As a USMLE aspirant, I aim to pursue a career as a physician in United States of America, and I am deeply appreciative of the opportunities and knowledge provided by Dr. Waqas Barni and the California Institute of Research and Technology. Today, I will be presenting my research on dysregulation of glucose hemostasis in transfusion-dependent thalassemia patients with iron overload as risk factor for endocrinopathies, a comparative study. This study was conducted at Thalassemia Center of Pakistan Institute of Medical Sciences in Islamabad. Beta thalassemia is a significant health issue globally, especially in low and middle income countries like Pakistan. Patients with beta thalassemia major require lifelong transfusions, leading to secondary iron overload. This iron overload can cause severe complications, including cardiac cirrhosis, hepatic dysfunction, and notably endocrinopathies, like impaired glucose tolerance. Our study aims to explore the relationship between plasma glucose level and serum ferritin levels, with specific focus on identifying dysregulation in glucose hemostasis using serum ferritin cutoff value of 2500 nanogram per milliliter. This is a cross-sectional study including 118 PMT beta thalassemia major patients from Pakistan Institute of Medical Sciences, Islamabad. Ethical approval was obtained and demographic variables such as age, gender, number of annual blood transfusion, and age at diagnosis were recorded. We categorized ferritin level using cutoff of 2500 nanogram per liter and assess glucometabolic status through an oral glucose tolerance test. Statistical analysis were conducted using SPSS statistics version 27. This study divided participants into two groups based on serum ferritin levels above 2500 nanogram per milliliter and below 2500 nanogram per milliliter. The individuals, which were 118 in number in our study, were divided on the basis of serum ferritin levels. 62 individuals with serum ferritin level above 2500 and 56 individuals were with serum ferritin level below 2500. In the group with serum ferritin level above 2500 nanogram per milliliter, the mean age was 13.25 years with an average of 19.21 transfusions per year, which is approximately 19 to 20 transfusions per year. They were diagnosed with beta thalassemia major at mean age of 13.14 months, which is around 1 year. And their mean 2 hours oral glucose tolerance test result was 156.18 milligram per deciliter. While on the other hand, in the group with serum ferritin level below 2500 nanogram per milliliter, the mean age was 9.6 years with an average of 16.90 transfusions per year. They were diagnosed at mean age of 9.58 months and their mean oral glucose tolerance test result were 139.6 milligram per deciliter. In terms of gender distribution, 57% of higher serum ferritin groups were male as compared to 38.7% in lower serum ferritin level. We found that patients with serum ferritin level above 2500 had a higher percentage of impaired glucose tolerance, which was 75%, compared to those with serum ferritin level below 2500, which was 54.8%. A small percentage of higher serum ferritin level patients also had diabetes. This percentage was 71.7.1%. Uh, while the group with serum ferritin level less than 2500 did not report any diabetes. Linear regression analysis showed a specific significant predictive relationship between serum ferritin levels and glucose tolerance level and blood glucose tolerance level, with serum ferritin level accounting for 15.6% of the variance in glucose level. Additionally, a chi-square test showed significant result for serum ferritin level and 2-hour OGTT results. Our findings are consistent with previous studies, confirming that high serum ferritin levels are associated with increased risk of impaired glucose tolerance and diabetes mellitus, which in turn are broader can be categorized in a broader way into endocrinopathies. The cutoff value of 2500 nanogram per milliliter for serum ferritin levels serves as a significant marker for identifying patients at risk for developing endocrinopathies. Early diagnosis and regular monitoring of serum ferritin levels are crucial for managing glucose metabolism disorders in beta thalassemia mature patients. In conclusion, our study highlights the critical relationship between elevated serum ferritin level and risk of impaired glucose tolerance and diabetes mellitus in beta thalassemia major patients. Regular monitoring and timely interventions are essential to manage these risks effectively. Further research is needed to explore the interventions that can improve the management of transfusion dependent thalassemia patients. Finally, our study's limitations include its cross-sectional design, single-centered study, and lack of hepatic iron data, which is the gold standard to check out the hepatic overload in these patients. Another limitation is the compliance information of uh, iron chelation therapy. Future future multi-center studies with larger sample size and additional data points are recommended to validate our findings. These were the these were the findings we these were the findings of our study, and thank you very much again for Dr. Barney and California Institute of Research and Technology for providing us the opportunity to present um, our study and our and we extend our thanks on I and I present the thanks on behalf of my whole team, which include all my co-authors and the supervisor. Thank you very much for letting us present this study, and we hope our study will add to the knowledge and will provide a better understanding of the management in beta thalassemia patients for iron over. Thank you very much.